Thank you so much, everyone, for joining us for this next webinar in our Fall Infectious Disease and Climate Change webinar series. It's good to see so many returning names, not faces, but names, as well as some new ones. So welcome, everyone. Before we begin, we want to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for a millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. Today's webinar, Laying the Groundwork for Predictive Models of West Nile Virus Cases, is brought to you by the Canadian Public Health Association through the Infectious Disease and Climate Change Project. Our webinar series aims to explore current and emerging infectious disease and climate change topics to share knowledge, research, and best practices. My name is Maddie Schuler, Project Officer with CPHA, and I will be moderating today's webinar. So for those of you who haven't heard me talk about this before, I wanted to take a quick minute to show you the winning posters from CPHA's Infectious Disease and Climate Change Grade 6 poster contest. This was an opportunity for teachers and students to learn more about climate change and the impact it is having on the spread of infectious disease like Lyme disease and West Nile virus in our communities. So students across Canada could submit a hand-drawn poster to bring attention to a climate-sensitive infectious disease for a chance to win a Chromebook and other great prizes. And we actually had over 700 submissions in 2022 and are currently gearing up to launch the third edition of this contest in early 2023. So stay tuned, and you can see all winning posters from 2022 at cpha.ca/contest, and that's also where you would go for more information. Just a few quick housekeeping notes before we begin. As you've all probably noticed, all the attendees are muted, so if you do have any questions for our presenter today or technical difficulties, please type them into the Q&A box at the bottom of your screen. After the presentation, I will read out the questions and our presenter will answer them, and we do strongly encourage attendee participation and look forward to hearing your questions today. Secondly, our webinar is being recorded and will be made available on CPHA's YouTube channel a couple days after the presentation, and presentation slides will also be shared. Lastly, we would love to get your feedback, so after the webinar, please fill out our 5-minute survey, which will automatically open up in your browser once you close Zoom. And we do read all of the feedback and try to incorporate as much as possible, so any comments are truly appreciated. Now, I would like to introduce our speaker for today's webinar. Alexander Sasha Keyel is a research scientist with the New York State Department of Health. His recent work focuses on climate change and emerging infectious diseases with an emphasis on West Nile virus. Broadly, he has experience in ecological modeling. His work includes modeling spatial impacts of noise on wildlife, effects of climate and land use changes on plants, and avian habitat use. He received his Bachelor of Science in Conservation Biology at Arizona State University. And with that, I will turn it over to Sasha.
Okay, thank you so much for that wonderful introduction. It's just going to take me a moment to share and get the PowerPoint up. Okay, can you see the screen? Is everything displaying properly?
Yes, all good.
Okay, thank you. So I'm going to talk to you about laying the groundwork for predictive models for West Nile virus in the context of humans. And before I begin, I want to acknowledge my funding. So I'm part of the Northeast Center of Excellence in Vector-Borne Disease, which is funded by the U.S. Centers for Disease Control. And we've also, some of the work I'm talking about has been funded by the National Institute of Health. And some of the collaborative project has been funded by the National Socio-Environmental Synthesis Center. And this is not just work that was done by me, that was done within collaboration with a number of other people. And so my collaborators have also been funded by different centers of excellence. There were 5 of them, as well as some external funding as well. And I need to acknowledge that the work I'm talking about is a product of many people involved. So these are the collaborators for climate change work on the CDC Forecast Challenge. These are the collaborators. We've received support through the Northeast Center of Vector-Borne Disease and also support through the department. Also, some of the work I will be talking about is coming out of a collaborative project, a multi-author project. So with that, for today's talk, we're going to do an introduction to West Nile virus. I'll talk about West Nile today with more of an emphasis on the US, but we'll talk a little bit about Canada and some of the state of the modeling for West Nile today. We'll talk a little bit about West Nile and climate change, and then we'll talk about what that might mean for policy decisions. So to use the CDC infographic, we can see that climate change has the potential to have a variety of impacts on human health. And for today's talk, we're going to be in this quadrant here, where the infectious disease and specifically vector-borne disease. And so we'll be talking in particular about West Nile here at the bottom. So for those of you who aren't familiar with West Nile virus, it's a flavivirus. It's spread between mosquitoes and birds. So you get an infected mosquito, it bites a bird, the bird gets infected, another mosquito bites that bird, then that mosquito can get infected. There's also been some research showing bird-to-bird transmission. So if the birds get into contact with each other, they can spread it directly. And for the most part, this isn't a main mode of transmission, but there is some concern with some of the birds that roost together, like crows, that there may be some transmission being propagated that way. As far as direct transmission to humans, it's mainly coming from when an infected mosquito bites a human. There's also concern about infection of horses. Humans and horses are considered dead-end hosts, however. So if a person is infected and another mosquito bites that infected person, the mosquito won't get reinfected. The viremia in the humans is not enough to infect another mosquito. So most of that's happening with birds, and it's not even all birds that are competent for West Nile. Some birds are very competent, like American robins, and other species really aren't as competent. And so if they get bitten, they can be a dead-end host as well. So since the audience is Canadian, I figured I would talk about West Nile in Canada a little bit. So in 2022, as of November 8th, there had been 22 human cases reported, 4 in Manitoba and 18 in Ontario. But the peak year was 2007 with 2,401 cases. And so there's been a couple of really big years early it was introduced to North America in 1999. So there's a couple of really big years kind of early on, and mostly it's fluctuating in lower numbers. I'm more familiar with West Nile in the US. Most of my research is focused on West Nile in the United States. It was first introduced to North America and also to the United States in Queens, New York in 1999. Since that, through 2020, there's been over 52,000 diagnosed cases of West Nile, but this is just the tip of the iceberg. So about 80% of cases of West Nile in humans is asymptomatic, so people don't even know that they've been infected. Another 20%, there's often fever associated with the case, and some of those cases can progress to be very serious. And then there's about less than 1% of the cases of West Nile where West Nile becomes neuroinvasive, it gets into the brain, and these usually result in hospitalization and sometimes result in death. So there's been over 2,000 deaths from West Nile in the time period from 1999 to 2020. From that time period, we had just under 1,000 cases in New York. That's over 1,000 now with the current year. And another state of interest for my research is Connecticut with about 166 cases. So this map here is showing incidence in New York, and so, or I mean, not in New York, in the US. And so you can see New York is actually relatively low incidence for West Nile. The highest incidence is here in the Great Plains region. But these don't account for the majority of cases. So because these areas are low population, when you have more cases per number of people there, but you don't actually have the most cases. Some of the places with the most cases are places like Chicago, Los Angeles, Phoenix metro area, some of the counties in Texas can be places that have a lot of the actual case numbers, but the highest incidence is happening in these Great Plains. Some of that's coming out of differences from mosquitoes. So out east here in this area, we have Culex pipiens as the major vector thought for West Nile. When you get out west of the Mississippi, it switches to being Culex tarsalis, and that's more of a rural mosquito associated with drainage ditches. It's a very seasonal virus. So this is CDC data again with the week of onset. And what you can see is that a lot of the cases are happening in late August, September, and into early October. So it's very seasonal. Some of this is thought to be related to a shift in the mosquito biting behavior with time. And so early in the season, there's birds sitting on their nests. They're very easy to bite. They can't really move around or avoid the mosquitoes. Once they finish with the nests, the birds are free to move around. Many of them group up. And if there's a lot of mosquitoes, they might leave. And so then you've got a lot of hungry mosquitoes and not as many birds for them to bite. And so we think that some of this has to do with a shift then to mosquitoes biting humans, being more likely to bite humans, because the peak of infection for mosquitoes tends to come around July. So it's the most infected mosquitoes actually precedes the numbers of human cases. The risk of neuroinvasive West Nile is also changes with age. So as you get older, you're more likely to get neuroinvasive West Nile. So the risk is relatively low for younger children, and then it increases as individuals get older, having a much higher incidence as people become older. It's very much still around. So I think some people were hoping it would just kind of go away, die down, but it's definitely still around. New York City is a good example of this. This is from the New York City's Department of Health webpage. And this year was a record year for their number of mosquito pools. So they had more sick mosquitoes this year than any other year. They've also had very high numbers of sick people, unfortunately. So there's been 36 neuroinvasive cases in New York City so far, with 9 of them West Nile fever, with 9 additional West Nile fever cases, and 2 people who were asymptomatic and went to donate blood and were found to be West Nile positive from their blood donation. And they screen the blood donations for West Nile because it can be transmitted that way as well. It's not, as I've mentioned, I'd like to keep a One Health perspective. I think it's important for thinking about infectious disease and especially vector-borne disease, that a lot of these diseases aren't just human diseases. And so it's important to keep them in the context of the natural world, the natural environment, and also some of the impacts that it can have on the natural environment, because human health and well-being is very connected to the health and well-being of the natural world. And there's been a fairly substantial avian impact of West Nile. So over 332 species have tested positive for West Nile. Millions of songbirds have died of West Nile. Most notably, American crows saw up to a peak of about 45% decline. But many of these populations are very resilient. So many of the crows have made a comeback over time. One of the species that was most affected in terms of numbers dead was red-eyed vireos. But really from the population data, you didn't really see much of an impact. So even though there were a lot of birds died, the next year, a lot of birds survived. They laid more eggs, a lot of the birds survived. And so just because there's a lot of population impacts, it doesn't mean that it's necessarily persistent, although there are some species of concern. So ruffed grouse and yellow-billed magpie are of conservation concern, and West Nile is thought to still be contributing to those species decline. It's also had an economic impact aside from the direct problems of health and morbidity. West Nile has had economic costs. So one study looked at the cost of healthcare in Texas in 2012 during a particularly bad West Nile outbreak there, and they estimated the cost to be at around $1 billion. Prior to the horse vaccine, there is a horse vaccine. There is unfortunately not a human vaccine for West Nile. $1.5 million of damage to horses in North Dakota in 2002. There's also been some suggestion that it's been causing problems for alligator farms. I suspect that that's not a major concern for people up in Canada. So now that we've got an introduction to West Nile, I'd like to talk a little bit about some of the models. But before I jump right into talking about the models themselves, I want to talk about thinking about the models and thinking about how you would model West Nile. And so models can be done at different temporal scales and different spatial scales. And temporal is just a fancy way of saying over time, and spatial is just saying over space. So your long-term planning models might be taking place with a resolution of years to decades. So what's West Nile going to be like over the next year? What's it going to be like in the coming 10 years? How would West Nile change with climate change? So that would be the case of a model that had a long-term planning goal. Medium term might be on the time frame of months to years. So how is West Nile, what are we looking at for the coming up? And then short-term planning, so this is where a lot of the vector control people or public health officials care about, might be on the scale of days to weeks. So they might want to say, do I make a public health announcement today? Do we spray for West Nile today or tomorrow? Do we need to schedule an aerial insecticide application? And then the other aspect is what the resolution is spatially. Are we talking about trying to look at an entire county or a management district and saying, okay, what's West Nile like over this management district? Or are we zooming in to a single management district or county subdivision area? So are we looking at a particular area? Or are we really getting fine-grained and saying, okay, where are we going to put the larvicide application? Are we going to treat, which catch basins are we going to treat operationally? And so that might require a model with much greater spatial resolution. And so, as I mentioned with the spatial resolution, these resolutions can be associated with with activities and also with different patterns. So climate might be more associated with some of these things that are happening at a multi-year average. You might see more seasonal weather patterns affecting monthly and annual timescales. You can have short-term weather on these daily week timescales. And then from weather conditions for spraying, they might be looking at hourly wind speeds and whether or not it's going to rain that particular night. And again, some of these management decisions are being made at different timescales as well. So larval dipping, trap collections, applying barrier pesticides, responding to resident complaints is happening very much in local or point locations on hourly to weekly timeframes. Some of the larvicide programs might be carried out over an entire operational area, while some other processes like looking at mosquito infection rates might be something that's being calculated at a county level, and they might pool all of the traps across the county and say, okay, this is what we're looking at for the mosquito infection. And then some of these public health campaigns might be happening. They might have an annual public health campaign. Outreach programming information might be happening at some of these timescales. So in one of our recent papers, we looked at what the distribution of the models are for these different timescales. So there was a recent review by Chris Barker, who's got an excellent lab for West Nile out of UC Davis, and has done a lot of really great work. And he reviewed models. And then what we did is we looked at the models in his review, what was the temporal resolution and what was the spatial resolution for those models. And so what you can see is that a lot of the modeling effort is happening here at this county scale, and a lot of the effort's happening also at the annual scale. And so we don't have a lot of great models at these really local fine scale resolutions. And that's a problem. It's something of concern. And I think there's a great need for more models at these scales at which some of these decisions are being made. Now, from a modeling standpoint, you say, well, why don't you just do that? It becomes a challenge because the models require data. And so getting the data at that scale can be challenging. So a lot of them from mosquito infection rates, it can be challenging to get enough data just to even get an accurate mosquito infection rate at the county level. And this is not to fault the people doing the work. They're doing a tremendous amount of work. They're out there putting out traps. They're taking mosquitoes back into the lab. They're counting through mosquitoes. And so there's a tremendous amount of work going into a lot of these data sets. But it does make it challenging to really be able to get some of these model results at the scale that's really useful to the people on the ground. And so that's something that needs to be addressed and needs to be thought about and worked on. So to look at that in a little bit more resolution, we picked a subset of those models where we were able to reach out to the investigators and people who were actively working on West Nile in the literature. And we looked at their models in a little more detail. So again, here we've got these broad scale processes, models that are telling us at the kind of the longer term planning over larger areas. And then on this end, there's more fine scale processes, models that might be more operationally relevant. And it's worth mentioning that just because the model is showing up here, this is talking about the scale of the model. It's not talking about the accuracy of the model. So just because the model can be applied at that scale doesn't mean that it's necessarily accurate enough for making decisions. And so that's a matter, so that can vary regionally, it can vary by model, but it's a separate question from what this figure is showing. So we're not saying that these are accurate models, we're saying that these are the scale at which the model is developed. And so many of these may still require additional accuracy, And so a few of the models that I want to call out, there's a model developed in the context of Chicago. I'll be talking about that model a little bit later. There's this Nebraska county years model. We're going to be talking about that one in just a little bit. A very promising model that's been working well in some of the Great Plains area that I won't be talking about much further is the ARBO model that's coming out of Mike Wimberly's group, and it's a great model. We'll also be talking about this model here in the context of select counties. And we'll also be talking about some of these temperature trait approaches coming up. And so it's a good overview of the scale to show where some of these models have been applied in the US. We've got this figure from a recent paper. And so like you can see that the functional linear model was developed in the context of Nebraska. There's been models developed in the context of Chicago. There's a very nice model coming out of Harris County that's looking at within season mosquito infection risk. California has been using a risk assessment model for, I don't know if it's a decade now, but quite a while. And then you can see that the EAKF model was developed and applied to a variety of counties across the US where they had enough data. And so there are a variety of models. They're being used across the US. This is mainly what's being shown here are being academic use, although some of these models are also trying to be transitioned into being used operationally. So in addition to this project, the Centers for Disease Control has also run a West Nile forecasting challenge. And the goal for the West Nile forecasting challenge is at this county annual resolution. So they're saying, can you predict how many West Nile cases will occur in the next year in real time? And so saying, okay, so the first time they ran this was 2020. Unfortunately, COVID happened, and so that kind of interfered with it in a number of ways, but they would still manage to pull off the challenge and make predictions. And this was for the lower 48 of the US, and this was specifically just predicting those neuroinvasive cases because those should be more standardized across the US. Because the fever, people may or may not go to the hospital. It depends on local culture and healthcare availability. But when it's neuroinvasive, people pretty much need the hospital. And so those are more likely to be reported nationally. And so there was a 2020 challenge, and then there was a 2022 challenge as well. So coming out of the 2020 challenge, the main insight for me was that the negative binomial model was one of the top models for predicting West Nile. This was actually a very depressing result for me because the negative binomial model is just a statistical model. It takes what was the historical distribution and says, this is what was observed. Here's what we're going to just predict that we're going to make a probability distribution based on what's happened historically by county, and we'll predict that going forward. So we'll give a probability estimate based on those historical distributions. And so it does a very nice job of statistically describing the process, but the big problem with it is it's not predictive in the sense of telling us one year is better than another. It just it doesn't make any distinction based on the year. So there's no indication of whether you'll be on the high end of that probability distribution or on the low end of the probability distribution. It just describes the probability distribution based on what's happened. It did a reasonable job of scoring across the US. It did better than the random forest model that I developed. That's this line here. We had a COVID adjustment, thinking people would be outside more and that maybe more people would get West Nile because of COVID and being home and in their gardens, and that performed even worse. So the statistical description did better than what we had with trying to make predictions based on temperature. I do think there's still some more room for improvement there. There were a variety of factors, one of which was that with COVID, there was a lot of other things going on in the world. And so the models weren't as well trained and well developed as I would have liked. There's also the potential that there was some reporting bias in the challenge. There's some concerns that the numbers of cases reported might have been fewer. With COVID, it might have been harder to diagnose some of the West Nile cases because if you went to the hospital with a problem, people were going to immediately assume it was COVID. So, but by and large, I think this is a reasonable result. That it looks like there's a fair bit of power in the statistical description, but a lot more work needs to be done into trying to really beat that statistical description to really get predictive information. But going from that, we decided, okay, if negative binomial is what works well, let's start using that model to make predictions for West Nile. And so what I did for the Northeast, since I'm part of the Northeast Center of Excellence for Vector-Borne Disease, is we fit the negative binomial to neuroinvasive cases from the CDC. We changed it up a little bit by requiring at least a 600,000 population minimum for making our predictions. And this was to avoid having a county that had low population, no West Nile cases, and saying, oh, there's no risk there because it's never had a case. Well, it's not necessarily that there's no risk there. It might just be that by chance you haven't had a case. And so if we have this population minimum, since it's a relatively low incidence disease, we can get a more accurate estimate of risk for some of these low population counts. And then the next thing we did was we looked at the risk and said, what is the probability of one case or what's the probability of 5 cases? And we looked at this for 1 and 5 year time horizons, but you could pick whatever number of cases was interesting for your district, and you could pick the time horizon that you were interested in from a planning standpoint. So there's some flexibility there. We just applied it to these particular ranges. So looking at that, we looked at what's the probability of 1 case in the next year. And the map doesn't come up. I don't think it would surprise anyone. So Suffolk County, Nassau County, New York City, these are areas that typically have at least 1 case of neuroinvasive West Nile. And you can see, so the risk matches with what we expect, and it's not surprising because it's a description of the historical cases. But you do see risk throughout the Northeast for West Nile, including in some of these low population counties. We can also say, what is the risk of having at least 1 case in the next 5 years? And so what's the odds of having 1 year with at least 1 case in that time frame? And now you start to see a lot more places are at risk of West Nile. And so there's likely to be a neuroinvasive case across this kind of Atlantic seaboard area. And also some of the places up here, I mean, this is Rochester, so it's a big city. So you're also seeing a population effect. So this is not an incidence map. This is looking at cases. And so there is an affected population that even though some of these places might be lower incidence, they have a higher probability of having a case just because of the number of people living there. So you are seeing this population center signal. But that's useful to know because if you're going to target your intervention, you might as well target it. You don't necessarily want to target the place with the highest incidence. You probably want to target the place where you have where you can prevent the most cases with the least cost. And then we can also look at this probability of getting 5 cases in a year sometime in the next 5 years. So it's not the probability of 5 cases over 5 years, it's the probability of 5 cases in at least 1 year. And it looks very similar to that probability of 1 case. So these are the places that tend to have the most cases overall. And so we can start to look at that, and then you can start to think about what kind of management you would want to do given these time horizons and given the infection rates. We also decided to use that negative binomial idea for the 2022 forecasting challenge. So we started for our 2022 forecast, we started with a negative binomial backbone. So we just used the negative binomial as our baseline for the US. And then we decided to try to patch in local models where we thought they would do better than that negative binomial. So we used a functional linear model that I talked about from those previous slides for the Great Plains. So we expanded it beyond just Nebraska to the entire Great Plains, and we weighted it. So in some places where we thought it would do really well, we put more of the weight towards that model. In some places where we thought it might not do as well relative to the negative binomial, we weighted the negative binomial heavier. And so it was a variable weight depending on how we thought the model would do in that location. For Chicago, we collaborated with the Midwest Center of Excellence with Rebecca Smith's group, and they estimated a minimum infection rate for Chicago, and then they estimated human cases based on that. For select counties in New York and Connecticut, we used that Bayesian ensemble adjusted Kalman filter approach. This is a population model. It models how many mosquitoes are infected, how many birds are infected, and how much spillover there is to humans. Nick DeFelice at Mount Sinai University is the lead on that. And the data for this model was provided by the Connecticut Agricultural Ecological Station and the New York State Department of Health. And we fed that into those models. And then finally, one thing that we did for our forecasts was we adjusted the forecasts based on reported cases to either ArboNet, which is managed by the CDC, or from the New York City Department of Health website, because cases were showing up there before they were showing up on ArboNet. And we just really didn't want to look stupid saying there will be 0 cases in this county and then have already be like a case in the county. So the idea was that once the number of cases was there, was reported there, the model shouldn't report below that number. Although that may have actually been a mistake because there were a couple of counties that had a case reported to ArboNet, and then later when we went to update it for the July, when we went to update it in August, the cases had disappeared. So I think it might have either been that they confirmed it was something else, or maybe the county of residence of the individual changed. And so we may have needed to have modeled the probability that given a case was reported at that time, it was actually going to be confirmed by the end of the year. So some sophistication may have been more sophistication may have been necessary. So to just look at that, so this is the region where we did the functional linear model. Here we applied the Chicago model. These blue are where we had the ensemble or the AKF model, and then the changes in shading are where we adjusted it based on reported cases as of August. So these are what we predicted for West Nile for 2022, so that you can see that the median predicted number of cases for most of the United States was 0 cases. There are locations where we predicted more cases where we predicted at least 1 case. And then some cases we predicted more, but it's important to note that this is the median predicted cases, not the actual number of cases that necessarily will happen. So for Los Angeles, even though the median was 11 to 32, the model was saying within the realm of expectations of the model would be up to 400 cases. So it's not saying that that's how many it will necessarily have. It's saying that the middle probability is that number of cases. You can look, I put in these insets to show the quantile probabilities for West Nile cases for 2 locations, but you could view it for any of the counties. This one's Suffolk. So Suffolk County in New York is likely to have fewer cases than Los Angeles, and had a lower median, but you can still see that the median is showing quite a bit of variation in this probabilistic context. It could have had 0, it didn't. It could have had more cases. So how did we do for the forecasting challenge? You'll have to stay tuned. There's a reporting lag for human cases, and the reporting lag can be up to several months. This can be a serious problem from some of the real-time models. So Nick DeFelice's model can work really well when it can get human cases reported, and he's done research to show how much better the model does when human cases are reported in a timely fashion. But doctors are very busy people, and so getting the cases reported up to CDC can take a while. So we actually don't know how well our forecast challenge model did, but we should find out in the coming year. So to kind of conclude the short-term side, the patterns of occurrence of West Nile can be very easy to describe, but getting truly predictive models is a challenge. And we're seeing some promise on the regional scale, and hopefully we can develop some of those regional models into a high-quality national framework. And hopefully we can get these systems to be able to update with new data. And there's a promising tool coming out of the University of California called VectorServe, where it's a national system for keeping track of mosquito infection data, and that this might provide a tool for getting some of this data into the models and into predictions in a more timely manner. So now we're going to shift gears a little bit. We're going to look at climate change and looking at West Nile risk under climate change. So, and looking at some of these more long time frame scales. So from prior research, it's pretty well established that West Nile is expected to expand northward into Canada. There's some recent studies. The virus should do better moving for north into Canada and over time. And there's research making predictions of northward expansion of vectors. So the Culex pipiens is being reported further north. There's been new records of it further north going up along the coast in Canada. The SAMI study was looking at Culex quinquefasciatus, I believe, and showing that one shifting north. And so we're seeing this northward shift of some of the mosquito species that are associated with West Nile. So our research looked at a pseudo-global warming experiment. So we looked at predicted future warming under RCP 8.5. So this was kind of a no change, no climate mitigation scenario to kind of look at what might happen by the end of the century looking at present day variability. And so the temperature predictions in this are relatively high. Hopefully it doesn't come to that, but we'll just see. It's what we used for the study from a research standpoint. For this project, we used those temperature trait R0 models. And one of the nice things about them is that they can use temperature and incorporate temperature into the modeling process. It uses a variety of different traits, so you can look at the biting rate, the vector competence of the mosquito, so how likely it is to transmit the virus, development rate, and some of the mosquito development traits, as well as lifespan. So some caveats with that: the temperature trait model assumes that all factors are equal. They aren't, so this is just looking at temperature-based risk, but we know that habitat matters a great deal. We know that having breeding sites available matters a great deal. We know that which hosts are available matters a great deal. It also matters whether the virus is present. If the temperature is perfectly suitable for West Nile, but no infected individuals are around, it's not going to amplify if it's not there. And these models have tended to be broadly predictive of seasonal conditions, but they haven't been particularly useful for predicting individual infections. So from an operational standpoint, we haven't gotten these models to the point where we can use them operationally, but for a climate change what-if scenario, they work really well. So we can look at this. So this is what the R0 looks like for Culex pipiens in West Nile, and the parameters are coming out of work done by Marta Shockett and colleagues, but we applied it to the Northeast. And if you're looking at these squares and triangles, you're wondering what those are. We picked 4 different counties from the study region and said, how are they likely to change from present day, which is the squares, into the future? And they kind of describe a variety of different trajectories. So some of the locations that are really low risk right now are expected to be much higher risk under climate change. Some of the places that are already relatively high risk might just change locations on that curve and not really change risk so much. And then some of the locations that are currently already a little bit past that temperature optimum are expected to actually come down in risk. So there's this idea of a unimodal relationship, and that the risk can actually decrease as well as increase for some vector-borne diseases with climate change. So some of the traits that are setting that curve are the vector competence. So below a certain temperature, West Nile just doesn't replicate fast enough in the mosquito to get to the salivary glands to be able to be put out into the spit when they bite the bird or the person. And so below that temperature limit, you really don't see a lot of West Nile transmission because it's just not getting to be infectious before the mosquito bites. The upper limit is also being temperature driven from lifespan. So when it gets too hot, the mosquitoes just die. And so if you die before you can get infectious or before you can bite, then it's hard to spread the virus. And then some of these other traits, the shape of these curves is helping shape what the optimum temperature is for the risk. And so how frequently they bite is an important trait. How long they live is an important trait. The mosquito traits, a lot of the development traits are a little bit broader, and so they're not having as big of a role in setting where the peak relative R0 is for West Nile. So what this looked like from our study was the present day risk for much of upstate New York is relatively low. There's these 2 models. This is a model artifact, the weather forecast model that we had that was predicting the future climate, overestimated the temperature in these 2 counties. So don't worry too much about those. But broadly, it's getting the picture right of lower risk upstate and greater risk downstate and into Connecticut. And then predictions with future climate change, we're expecting the temperature to be a lot more suitable upstate across New York. But in some of these downstate regions like New York City, Nassau County, and in some of the higher risk locations in Connecticut, we're actually expecting the future risk to decrease due to climate change. So extreme climate change would actually decrease the risk of West Nile. Now, before you rejoice too, so that's good news from a West Nile standpoint, but from an infectious disease standpoint, that's not the complete picture. There's other mosquito-borne diseases that do better at higher temperatures that could potentially shift northward. So it's not the total story, but from a West Nile standpoint, long-term climate change is looking like it will probably actually get less bad in some locations in this area. Broadening out to the picture to the whole Northeast, this is a separate project. We calculated that relative risk, temperature-based risk for the entire Northeast. There are some areas that it's obviously not doing very well at predicting risk, because as you might have seen earlier, and I'll show a comparison in a little bit, some of these areas are actually very low risk based on that negative binomial model. So that's that all other factors aren't equal part of it. But it does a reasonable job of describing the present day risk. And kind of the bottom line from this figure is that the change in risk is expected to increase. We looked at a 0.5 degree warming in this study, and the idea was to try to say, okay, we know what it might happen in the long term, but what's going to happen on the scale of potentially the next decade? What do we think might happen for 2030? And kind of the bottom line takeaway for this region is that the change in risk is actually not huge. It's a relatively small change in that relative risk for 0.5 degree of warming, but the risk is expected to increase for most areas, with some exceptions. So some places are actually expected to stay about the same or decrease in risk. So the places that are warmer now might stay the same or might decrease a little bit. So zooming in on some of the more populated areas, so this is by county, but these are mapping to some of the major metropolitan regions like Boston. This is a different Suffolk County than I'd mentioned earlier. That's Suffolk, Massachusetts, not Suffolk, New York. Manhattan is officially known as New York County. Baltimore City, there's also a Baltimore County. It gets a little bit confusing to the computer when you're running the analysis. You have to make sure it knows which is which. And then this is Washington, D.C. And so what the takeaway from, so we've got the different locations, and then this is just a hypothetical what if. So if we had present day, 0.5 degree of warming, 1 degree of warming, all the way up to 4 degrees of warming. And so some cities are currently at their peak risk. Some cities are maybe past peak temperature-based risk. And some cities are expected to reach their peak risk into the future. This might be more reflective of what the situation is in Canada. With being a more northern location, being at cooler temperatures, we're expecting probably climate change will lead to increases in risk. So this is just that comparison of the probability of one case in the next 5 years to the relative risk. And so you can see that it's definitely this relative risk is overestimating risk in some of these locations, and we're not seeing that temperature-based risk in some of these southern locations. But it is still giving us some of this broad pattern. And so I think the climate change results of increased risk across should be relatively stable. So to just bring it back to some policy relevant conclusions, just because there's low risk, just because there's a year without much West Nile, it doesn't mean that you're at low risk and that West Nile's gone away. You could have a few low risk years from drawing from this negative binomial distribution. Low case numbers are not a reason to be complacent. This is especially true because Nile can come in cycles because the birds can build up immunity after a bad year. And so a bad year might be followed by a couple of low risk years. Northern location experience more West Nile and increase. So West Nile is expected to increase across Canada. And then we need a balancing act there. We need to think data necessary to weigh that against the benefits of the model. And with that, I'm happy that concludes my talk, and I'm happy to take any questions that you might have.
Wonderful. Thank you so much for that presentation, Sasha. That was great. At this point, if anyone has any questions, feel free to submit them using the Q&A box below. And I do think we have one question coming in. One attendee says, great talk. When you have a predictive model of the number of neuro cases you're expecting, how will that translate to public health action? Is it primarily to direct mosquito control efforts, or are there other actions you could see being triggered by the early warning that the models could provide?
That's a great question. So there's a variety of potential actions that can be taken. So some of it can happen at the public health department of giving warnings, just telling people the things that they already know. West Nile's in the area, use your bug spray, try to wear long sleeves, try to limit exposure to West Nile mosquitoes. It can also be, so ideally, a lot of the people would want to have models that could work on the vector control side of saying, okay, apply vector control here. But even from a vector control standpoint, there's a variety of responses that vector control can take. So some of the things that vector control does is on your annual time scale. So around here, a number of the counties apply larvicide every year. And so you could identify, so some of the models can say, okay, these are the counties that are higher risk, or maybe this is a particularly higher risk year, so maybe apply more larvicide. It would be nice to have some of these models that would be really fine scale and say, okay, this is where West Nile is, target this location. But I don't think for the most part, the models are able to support that level. Part of the problem is also, it's not just a fault of the models, it's that sometimes West Nile is spread out over a larger area. So just because one trap in a particular location is positive, it doesn't mean that that's the only location that has West Nile. You might actually have infected mosquitoes over a wider area. And so it might just be beyond their capacity to treat that entire area.
Right, right. And I guess a question going off of that is, do you find that there are, or I guess, what are the gaps between predictive models and kind of decision making?
So I think that was one of the big highlights of the study, is that there are these gaps of the scale at which the model, it's easy to develop the models, and then the scale at which the decisions are made. There's also the scale of the timing of many of the models are going to be relying on the surveillance data that's happening in the season. But if you're a vector controlled district, you may have needed to hire your staff back in before the season began. Mm-hmm. And so there's this tension between when can the models give us the information versus when do the decisions have to be made. And so a lot of the decisions are being made, maybe some of the vector control decisions are being made in December of the year before.
Right.
And so that's very hard to get. So that's where the negative binomial model can be useful, is it can give you some information about the general conditions, but trying to get a very specific predictive model of saying, okay, yeah, next year is going to be really bad in December is very difficult, because like you don't know the weather, you don't know where West Nile is going to have shown up in the landscape. And so some of these things, from a limits of predictability standpoint, it might be something that the model just isn't going to be able to tell you. I mean, maybe somebody will come up with a really clever idea of how to map it out and link it together, because some of these things are random until you figure out the process driving the randomness. But there's definitely some challenges and gaps between where and that scale mismatch of, obviously everybody wants it fine scale, super accurate. But what you can, the more zoomed out you are, the more accurate the models tend to be.
Yeah, that makes sense. Thank you. We have more questions coming in, I think. Lots of great talk, great presentation. One attendee asked, this may be out of your scope, but what are the environmental impacts of larvicide, as an example, food source or insectivores?
That's a great question. It's not my area of expertise, so I'm a little hesitant to answer it. My understanding is that they tend to the larvicide tends to have less external impact. The other aspect is often what they're places that they're putting the larvicide are places like catch basins. So it's like a storm drain. So it's not like they're going out and dumping it in ponds and wetlands. They're dumping it in urban built environments. That said, I'm not an expert on the non-targeted effects, and I think it's a great consideration. And it's something I would love to model and say, what is the trade-offs of applying this versus the non-target effects versus the benefits for humans? But that tends to be why they use the larvicides rather than some of the adulticides, is that they can be more targeted to the mosquitoes in particular.
Okay, interesting. Thank you for the question, Maria. We have another one coming in. Would it be effective to differentiate the models based on population density? Could urban planning help to curb the spread of cases?
So population density is a big factor in West Nile, and it's actually kind of an interesting trade-off, because if you have like Manhattan, you tend to have such a built environment that there's not as many breeding habitats for the mosquitoes. So a lot of the places where you really see the most West Nile, at least on the East Coast, is kind of in a suburban setting. So where people are having bird baths, where people might have kind of a yard, and you kind of have people spending time in the garden. So if you have too much development, it's not great for West Nile, because you don't have the breeding habitat. If you have too low of density, you don't have as many people to get bitten by the mosquitoes. And so there's kind of this suburban areas tend to have the highest risk for West Nile. So there definitely is an interplay. There's also potentially interplays of how you develop the environment, of how you develop the infrastructure. So with Suffolk County, New York, there's been some studies that show that West Nile is associated with people being on septic systems. And so some of the human infrastructure associated with it can have a factor as well. There was a study, I think it was out of Texas, maybe California, don't quote me on exact location, but they were finding that West Nile was associated with abandoned swimming pools, that if people were tarping over their pools, rainwater was falling onto those tarps, you were getting leaf matter into those tarps, and that was turning into breeding habitat for the mosquitoes. And so there are definitely some of these urban planning things about making sure you minimize breeding habitat for mosquitoes that can help to curb the spread of some of the mosquito-borne diseases.
Thank you, Sasha. Great question. Again, if you have any more questions, please type them into the Q&A box. And I guess one question that I have would be, Sasha, how would you like to build upon or expand this work in the future?
So right now, what we're trying to do is we're trying to take that CDC forecast challenge. We're trying to we're trying to add in additional models. We're going to also, another goal is to try to change it from being just a county annual scale, but to see if we can get more finer scales with it. So can we look at seasonal patterns? Can we look at sub-county scales and try to get a little bit more resolution there of where are the places that we really need to be concerned about? Some other things that I would really love, but we've been limited on the data side, is getting some more of the pesticide information into these databases. Getting the mosquito data shared into public databases. So a lot of the times the mosquito control districts have their data, and it's like within a state or within a control district, and it can be very difficult to share some of these data on West Nile. And I think greater openness about the data could make it a lot easier to develop some of these models and have more targeted approaches. So I guess I would like to see more data, more shared data, and improvements on spatial scale, and kind of building out as we see models doing well, trying to be able to incorporate them into a national framework for prediction.
And I think that's the case for a lot of vector-borne diseases, just in terms of sharing more data. So thank you. And I don't see any more questions in the chat. So with that, thank you so much for joining us today, everyone. Thank you so much, Sasha. That was incredibly interesting. If you have any questions for our presenter after the webinar, please contact me and I can get, I'd be happy to connect you two. And again, thank you everyone for joining us. A quick reminder, please don't forget to fill out that survey that will pop up automatically when you close your browser. And a big thank you again to Sasha, and everyone enjoy the rest of your week and weekend. Thank you so much.
Thank you so much for having me.
Anytime. Take care, everyone.